Good morning, everybody. My name is Nagachandrika Pallam, Assistant Professor working in Sridatta Institute of Pharmacy. Uh, Today, I am discussing the Unit 5 topic of bioequivalence for the subject of generic product development for the class of B.Pharmacy 3rd years, first sem. So, what I am discussing in this topic means definitions, history, objectives, significance, and references I am discussing. So, definitions. First, before going to the definitions, what is the bioavailability? What is bioavailability definition? So the name itself tells that bio is nothing but the life. Availability means to get something means how much available. See here, what is available means drug is available. Here bio is nothing but the life is nothing but the system. So see how much of the drug is available within the system, that we call it as a bioavailability. Here system is nothing but the systemic circulation, that is nothing but the blood. So how much of the drug is available within the systemic circulation, that we call it as a bioavailability. Here, so how much of the drug, here we have to measure how much of the drug is reaching to the systemic circulation and how much speed it is reaching to the systemic circulation, compulsory we should measure. So that only the defined as the measure of the rate and extent of the drug which reaches to the systemic circulation, in contrast to the stated on the label. So how much speed it is reaching to the systemic circulation, how much amount it is reaching to the systemic circulation, that we call it as a bioavailability. Okay, FDA revised this bioavailability definition. So before that, bioavailability is nothing but we are calculating for the active drug ingredient only. We are not including therapeutic moiety. But FDA reviews this definition. They included the therapeutic moiety also, showing the therapeutic action. That's why it is also therapeutic moiety also included in this bioavailability definition. Coming to the bioequivalence, what do you mean by bioequivalence? You are taking a drug substances in 2 or more identical doses form reaches to the systemic circulation at the same rate and same relative extent, that we call it as a bioequivalence. Once again I am telling, so two or more formulation, if you are take 2 or more formulations, these 2 or 3 formulations are reaching to the systemic circulation with the same speed and the same amount it is reaching to the systemic circulation, then we call it as a bioequivalence. So that we call it as a bioequivalence. Coming to this bioavailability, so before going so in IV route, the drugs, whatever you are administering the drugs, it is reaching to the 100% bioavailability. So directly we are injecting to the systemic circulation. Through the IV route, it is directly reaching to the systemic circulation. So 100% bioavailability we will found. By the oral route, only 5 to 100% of the drug only available. By the rectal route, 30 to 100% only. And inhalation route, 5 to 100%. And by the transdermal, 80 to 100% of the drug reach into the systemic circulation. So the main problem with the oral routes, but in our pharmaceutical field, 90% of the drugs are manufactured through the oral route of administration only. That's why we have to study the oral route. So how, here see when you are drug administering through the oral route, from this dosage form, API reaches to the stomach, and through the stomach it reaches to the small intestine, through the small intestine, through the villi, it reaches to the liver through portal vein, through the portal vein it reaches to the systemic circulation. So it should it should cross the various organs to reach the systemic circulation. So some of the drug should be degraded, otherwise it is interact with some, you have to see whether this drug is interacting with any organ or the food substances or the pH condition. If anything with the dissolution, it is altering that we have to measure. So why it is very important means bioavailability, why it is important means if FDA, if you want market your doses form into the market, that means the FDA need permission, you need a FDA permission approval. So FDA, when it is approved, when you submit these bioavailability studies, then only this FDA will be approved. So compulsory, when if you want to market your product means you should get FDA permission. FDA needs bioavailability studies and bioequivalence studies, then only they will approve for the marketing. So so how it is origin, go to the history. So how it is origin means some instance happen, because of that the FDA mandatorily submitted to FDA. They required compulsory bioavailability and bioequivalence studies. So when it is origin means 1912 first drug absorption done on the sodium iodide drug. So and after that 1913 Walker and Nelson, the vitamin B12 they tested on the rats. Okay, they took the fresh yeast and dried yeast and they tried on the rats. So after some incidents happen, after that these bioavailability studies are mandatory to submit to the FDA. So what are those means? Clopramamide. What is this clopramamide means? They took three formulations with the consent of the physician. They intimated to the physician, and they took the three formulations, marketed formulations of the chlorpromidine, and they tested for the bioavailability studies. From these formulations are showing the same peak level, but one formulation is showing the less therapeutic effect and low plasma concentration compared to two formulations. So next is the digoxin in 1971. The New York, they took the different formulations of the digoxin and studied on the healthy human volunteers. So it showed the different plasma concentrations. Why it is showing different plasma concentrations means each formulations maintaining different particle size. Due to this different particle size, it is showing the different plasma concentration. That's why particle size are very important. So these pharmaceutical factors are very important for the before before launching to the market. The particle size is very important. So in 1975, 15 cases are taken in Israel, and these formulations are with the intervention of the physicians. They took the formulations and they tested on the patients. So what happened with the some formulators, what they did, they added some dissolution, means lack they increased their bio dissolution. So what happened, the bioavailability also increased to 2 to 3 folds. It is increased means what happened, if the 2 3 folds it is increased means it is showing the toxicities. So the patient needs the minimum therapeutic effect only, not the maximum therapeutic effect with this digoxin. So maximum therapeutic effect leads to the toxicities. So that leads to the cardiac arrest. So next instance is phentoin. Phentoin is a sudden outbreak of the phentoin toxicity in Australia 1968. So 68, what happened means here supply of the inert excipient like calcium phosphate. The calcium phosphate is a excipient. This excipient is replaced with the Lactose. Okay, lactose, already you know that it is a it is having the wetting property. That means it is increasing the faster dissolution. It leads to faster dissolution. Faster dissolution leads to the increased plasma concentration. If the dissolution increased, means already you know that absorption also increased, so it leads to the uh, absorption. So what happened from this toxicities happen with this phentoin. So what are the toxicities we found? Means tumors, ataxia, gait, double vision, and vomiting happen. So these are the toxicities we found. From that onwards, the FDA mandatorily insists that we have to submit the bioavailability and bioequivalence studies before going to market. So what are the objectives? So here, what is the purpose of bioavailability studies? So when we are developing into a primary stage development of a suitable dosage form for a new drug entity to obtain evidence of its therapeutic utility. That means when you are developing into a new suitable dosage form, whether it is maybe a oral route or IV route or transdermal route, at the primary stages of development, you should submit, you have to conduct this bioavailability studies. So not only that, determination of influence of the excipients. So when you are converting into a generic product, you are changing your excipients. So at the time, how these excipients influencing on the patient, or how the pharmaceutical factors influencing do, on the patient, or the patient related factor influencing on the therapeutic absorption. If you want to study these pharmacological factors and patient factors influencing the excipients on the absorption, at the time you have to submit this bioavailability studies. Not only that, when you are converting into a new formulation, or if you are changing into a route of administration, or if you are changing your excipient with a generic product, then you have to submit this bioavailability studies. You have to conduct bioavailability studies. Not only that, the control of the quality of the drug product. So various stages, means if you want to if you have to conduct this means you have to control the quality, then what you have to do, time to time you have to observe the therapeutic levels. So that means the stability levels and pharmaceutical factors are in process, in process stability studies, and in process the absorption studies. So at the time you have to submit this with the bioavailability studies only, you will get know that whether this product is the same as it is like before or not. You can know by these bioavailability studies. And comparison of the bioavailability of the substances, like drug substances from different dosage forms. Like when you are comparing with the IV dosage form to this oral route, or oral route to other extravascular routes like a rectal route, or otherwise vaginal route, or the sublingual route. So when you are comparing with the other routes, you have these bioavailability studies are very very important. Okay, next, coming to this significance. What is the significance of this bioavailability studies? So drugs having low therapeutic index, like cardiac glycosides, quinidine and phentoin, these low therapeutic, these drugs needs a low therapeutic index. So it is when you are administering a low therapeutic index, means The drugs having the low therapeutic index like cardiac glycosides, quinidine and phenytoin. That means these are drugs having the low with the small doses from like 15 mg, 5 mg and 20 mg. These drugs having the low dose. So with the low dose of the drugs, you have to you should not change the branded drug. So these drugs need the same therapeutic level. We should, if you are changing the branded drug, branded drug with the other drug, that what will happen, the therapeutic index will be give the fluctuations. So it will lead to toxicities. So at the time of maintaining a low therapeutic index, drugs like cardiac glycosides, quinidine and phenytoin, these bioavailability studies are very, very important. So next is the drug whose the peak levels are required for the effective of the drugs like phenytoin, phenobarbital, primidone and sodium valproate, antihypertensive, anti-diabetic and antibiotic drugs. So these drugs are actually antihypertensive drugs, needs a high plasma concentration. They require the high plasma concentration levels. At the time, these bioavailability studies are very, very important. We should maintain continuously maintain these plasma concentration within the systemic circulation. Otherwise, it will not show the pharmacological action. If it is decreased, means the toxicities will happen and it will lead to cardiac arrest. So, like diabetic anti-diabetic drugs, like it needs a 20. The drug, systemic circulation needs continuous plasma concentration, peak plasma concentration. Otherwise, the glucose should maintain blood glucose level, blood plasma glucose level. So for that, to maintain this controlling this plasma glucose level, we need to we need the plasma concentration. So continuous plasma concentration we have to maintain. So at the time, these bioavailability studies are very, very important. Antibiotics, when you antibiotics are nothing but to kill the microorganisms. So if you want to kill these microorganisms, means you have to maintain the peak levels continuously within the plasma. So at the time, these bioavailability studies are very, very important. So next one is drugs that are absorbed in an active transport. So if it is through the ionic transport, there is no need to no need to concern. But when it is going to the active transport, the carrier molecules plays very important role. Sometimes what will happen when you are taking the two three formulations or the 2-3 drugs, the competitive antagonism will be happen, and sometimes the carrier will be saturated to carry this drug molecule to the plasma level. So at the time, the drug will not reach the to not maintain the therapeutic levels. So at the time, these bioavailability studies are very, very important. The drugs which are disintegrated in the alimentary canal and the liver, like chlorpromazine drugs, those are which undergoes the first pass metabolism. So when it is going to the first pass metabolism through oral route, it should degrade it in the alimentary canal. By this, the drug should be degraded. So at the time, we have to maintain the plasma concentration. So these are very chlorpromazine we are using for the antipsychotic drugs. So these we have to maintain to observe this fast metabolism. These bioavailability studies are more important, and the formulations are given the sustained release drug. So if you want to prolong your drug release, otherwise you have to prolong the therapeutic activity. What you have to do, you have to convert into a novel drug delivery system. Novel drug delivery system is nothing but we have to control the releasing of the drug. We are maintaining how much time we are controlling the release. If we are controlling the release means we can bioavailability will be increased, means slowly the drug will be released to the small intestine through the systemic circulation. It reaches continuously, and the bioavailability we can increase the bioavailability. So at when we are converting into a controlled drug delivery system, these bioavailability studies are very very important. When through the oral route, how we are controlling means we are prolonging by which material we are controlling the release means by using the polymers. So when you are converting, we are using a different polymers, different excipients. We have to check this bio with the bioavailability studies only. We will know that which excipient is showing the better control release, and which polymer is showing the prolonged release, and which polymer is showing the best release. Then we can detect by this bioavailability studies only. So in addition to any new formulation, if you are converting into any new formulation, these bioavailability studies are very very important. So this is the bioavailability studies importance. Not only that, but these bioavailability studies are mainly two types. One is absolute bioavailability, and there is a relative bioavailability. Absolute bioavailability is nothing but when you are uh, when you are comparing with the extravascular route to the IV route, then we call it as a relative, means absolute bioavailability. So relative bioavailability, when we will discuss this relative bioavailability, the name itself tells that relative means same route of administration. We are comparing with the one bioavailability with the reference bioavailability with the test bioavailability, then we called it as the absolute bioavailability. It's relative bioavailability. Relative bioavailability is nothing but same route of administration comparing with the branded versus generic, otherwise marketed versus tested, then we called it as a relative bioavailability. Absolute bioavailability is nothing but we are comparing the different routes, means same formulation, same API, but we are comparing with the marketed versus market IV oral versus the IV route, then we call it as a absolute bioavailability. So these are the introduction of bioavailability. So what I referred means this Brahmakara is a very simple and best language, and my favorite book is the basic pharmacokinetics like Leon Shargel, 5th edition, Willy publications. So it is very very important, and Google also I bought some information. So this is about the introduction of bioavailability.